Hello and welcome to our presentation on the Colorado Physical Therapy Dry Needling Requirements. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance website that specializes in physical, occupational, and speech therapy. We offer monthly live, full-length continuing education courses, guides and sample policies for Medicare, TRICARE, HIPAA, NCCI, OSHA, and other important federal laws, information and updates for most private insurance companies, including Medicare Advantage plans and Medicaid plans. We are working on PT, OT, and SLP compliance guides for all 50 states, along with information on Medicaid, workers' compensation, home health, and pediatric services. And we offer ongoing and comprehensive support for our members, which means that members can email us with any therapy, compliance, or billing questions for no additional cost. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. Dry needling is a physical intervention that uses a filiform needle to stimulate trigger points, diagnose and treat neuromuscular pain and functional movement deficits. It's based upon Western medical concepts, requires an examination and diagnosis, and treats specific anatomic structures selected according to physical signs. A physical therapist must successfully complete a formalized course of study provided by a qualified licensed healthcare provider that includes a minimum of 50 hours of education, of which 40 hours must be in-person education, and education may be broken up into more than one part. A PT is permitted the limited practice of dry needling once the PT has completed 30 hours, as long as such practice is confined to the scope of education already successfully completed. This includes specific knowledge and psychomotor objectives, includes clinical decision making, and includes written and psychomotor assessment of knowledge and skills. All parts of this education must be successfully completed within 4 years. If the physical therapist has not completed at least 50 hours of dry needling training within 4 years, then the licensee must stop performing dry needling at any level until the licensee has completed at least 50 hours. The formalized course of study may be completed during the PT's entry-level education. To apply this education to the requirements, the remaining parts of the education must be successfully completed within 4 years of the date of the original license. PTs performing dry needling in their practice must have written informed consent signed by each patient for whom dry needling is provided. A copy of the signed consent form shall be available to the patient upon request. The written informed consent must include risks and benefits of dry needling, including the risks of pneumothorax, neurovascular compromise, and infection. Dry needling must be performed in a manner consistent with generally accepted standards of practice, including clean needle technique, use of gloves, and safe needle and biohazardous waste disposal. When dry needling is performed, documentation must include a description of the technique, tissues treated, and post-treatment assessment. Dry needling should not be delegated and must be directly performed by a qualified PT, including needle removal and post-treatment assessment. PTAs may not perform dry needling. Thank you for watching this presentation. If you enjoyed it, please like and subscribe, and please visit us at www.therapycomply.com.